Turning and positioning a client on bed. The definition. It is the technique in repositioning a client on bed. The purpose. It aims to prevent complications that may arise while a client is confined in bed. The equipment. Pillows, roll blanket or towels, footboard, and hospital bed. Next is the procedure, which is the assessment. First, assess the client's physical abilities, level of comfort, and ability to follow structure. And second is check the client's chart for diagnosis. Next is the planning. Wash hands to prevent the cross-contamination and organize and check the device for its function of the bed, lifter, and trapeze. Next is the implementation. Identify the client, explain the procedure to the client, raise bed to safe working height and ensure the brakes are applied, secure all tubes, drains, and IVs, and place or assess clients in a starting position. Dorsal or supine lying horizontally on the back. First, slide the patient and mattress to head of the bed and remove the pillow. Lower head of the bed unless contraindicated. Turn patient onto his back, replace the pillow, wash hands, and document procedure. Next is the dorsal recumbent. Slide patient and mattress to head of the bed and remove the pillow. Lower head of the bed unless contraindicated. Turn patient onto back. Assist patient to raise legs, bend knees, and allow legs to relax. Replace the pillow, wash hands, and document procedure. Next is the lithotomy. Request patient to slide buttocks to edge of examining table. Lift both legs. Have patient bend knees and place feet in stirrups. Drape patients. Wash hands and document procedure. There are several types of Fowler position. First, low Fowler's position is when the head of bed is elevated to 15 to 30 degrees. Second, semi-Fowler's position is 30 to 45 degrees. Third is the standard Fowler's is 45 to 60 degrees. And the last is the high Fowler's position is 80 to 90 degrees. Next is the Fowler's. Slide the patient and mattress to head of the bed and remove the pillow. Raise head of the bed to decided degrees, which is the 15 to 30 degrees. Replace the pillow, slightly raise foot of bed, wash hands, document procedure. This is the Arrhythmic. Elevate the head of the bed to 90 degrees. Place pillow between patient's back and mattress. Place pillow on over bed table and assist patient to lean on, placing head on pillow. Wash hands and document procedure. This is the same position. Have the client flex his knees and place his one arms across his chest. Place your hands on the shoulders and hip on the far side. Gently roll the client towards you. The bedside rails and move to the opposite side of the bed. Adjust the client until he or she is in correct side lying position. A pillows may be replaced to support client's head and arms. This is the prone position. Move the client to the extreme edge of the bed. Raise the side rails on that side and move to the other side and move to the other side of the bed. Place the client's near arm under his buttocks with the palm arm up, bringing his far leg. Turn the client's face away from you. Grasp the client's far hand with your hand and his hip with your other hand. Gently pull and roll the client towards you onto his abdomen. Move the client into the center of the bed. A shallow pillow may be used to support the client's head. Next is turning the client from prone to supine position. Place the client's far hand under his far thigh. Cross his near leg over his far leg and turn the client's face towards you. Gently roll his body away from you into his back. And move the patient in the middle. After the move is completed, a footboard may be used to support the foot. Additional pillows may be used to support clients' heads, Arms and lower back. Move bedside table near to bed and place items frequently used within the reach of the client. And after, wash hands. The niches or genopectoral. Turn the patient onto abdomen. Assess patient to kneeling position. Arms and hands should rest on pillow while upper chest rests on bed. After is wash hands and document procedure. Next is the Trendelenburg position. Place patient's head lower than body with body and legs elevated and on incline. Bed may be elevated on blocks for performing anal surgery and not used if patient has head injury. After is wash hands and document procedure. 1. Evaluate client's tolerance and respond to the procedure to be able to know what the patient is comfortable and evaluate the client's position for alignment and evaluate any abnormal finding on skin assessment to have a data that those abnormal findings is not true because of the positioning. Is the documentation. Record the client's position, record any compliance of pain, dyspnea, and discomfort observed during repositioning. And last is the record the client's response after the procedure to have a data of everything before and after the procedure. Transferring technique. Transferring technique. It is the use of proper body mechanics in repositioning, lifting, and transferring of patients safely. The purpose to position and prepares the client for a variety of clinical procedure and the movement maintains and restore muscle tone. The equipment: bed, wheelchair or chair, stretcher, pillows, and safety belt. Assessment. Check the doctor's order and client diagnosis and restriction to be able to know how to handle the patient. Second, assess the client's ability, level of comfort, muscle strength, presence of paralysis, and ability to follow instructions to know what the nurse should do if the patient can't do it. Planning. Wash hands and obtain equipment needed and check its function to avoid cross-contamination, to save time and effort, and to avoid malfunction. Implementation. Identify the client, inform client about desired purpose and destination, lower the height of the bed and slowly raise the head of the bed if not contraindicated. Place one arm under the client's legs and one arm under the client's back. Slowly pivot the client and put client in sitting position. Allow the client to dangle for 2 to 5 minutes. Bring the chair or wheelchair close to the side of the bed. Place it at 45-degree angle of the bed. Put transfer belt and other transfer aid is suited and secure. Lifter's knees flex with back straight, hand gripping each side of transfer belt. Back each client up in a standing position to the count of 3 while straightening hips, legs, and keeping knees slightly flexed. Lifter and client pivots so the lifter and client's back is toward chair, lifter still holding the transfer belt. Instruct the client to use armrest on the chair, flex hips and knees while lowering into chair or wheelchair. Secure the safety belt. Place client's foot on pedal. We need to wash hand. Next is the evaluation. Evaluate client's response and tolerance to the procedure to check if they are comfortable. Next is the documentation. Record the purpose or record any report of pain, dyspnea, and discomfort observed during the transferring and record client's tolerance to the procedure. To have the data that that procedure is done and to have the data of the transfer. Next is the assisting client from bed to stretcher, 3 assistants. Assessment. Assess amount of assistance required for transfer and assess the client's ability, level of comfort, muscle strength, presence of paralysis, and ability to follow instruction. Next is planning. Wash hands and obtain equipment needed and check its function. Implementation. Identify the client, inform client about desired purpose and destination. Position stretcher with head near foot of bed. Raise bed to 1 inch higher than the stretcher and lock brakes of the bed. 3 or 2 lifters stand side by side facing the side of the client's bed. The tallest places one arm under patient's back and shoulders. Second nurse places one arm under waist and thighs. Third and shortest lifter places arm, legs under legs. Lifters roll client toward the chest on count of three. Client is lifted and held against nurse's chest. On count of three, lifter step back and pivot towards stretcher. Lifter gently lower client on the center of the stretcher by flexing knees and hips until elbows are in level with edge of stretcher. Position client on stretcher. Place pillows under head and cover client with blanket. Assess client's body alignment. Place safety straps across body and raise side rails. After the procedure, next is wash hands in order to avoid contamination. Next is the evaluation. Evaluates client's response and tolerance to the procedure to check if they are comfortable, and evaluate the client's body alignment onto the stretcher for the patient to save energy. The last is the documentation. Record the procedure, record any report of pain, dyspnea, and discomfort observed during lifting, and record client of tolerance to the procedure in order to have the data that the procedure is done. This is Anna Marie A. Eating BSN 1C student. Thank you for watching.